little bit late. It's been kind of a crazy day. I think it always is. And it seems like it's always on Dr. Canizaro's day that I am just shoveled like nobody's business. So I apologize. Um, it just, I don't know. It's just like the Dr. Canizaro. Well, let me introduce you guys if you don't know, and you should by now, because Dr. Canizaro is probably one of my most giving with her time. So let me introduce you to Dr. Robin Canizaro, who is out of Florida. She is a holistic homeopathic veterinarian. So she's like a triple whammy, right? So she's a veterinarian, she's holistic, she's homeopathic. So it's the triple threat, I guess. We shouldn't call it a threat, but you know how they say, like, people in like the Hollywood, where they're they can sing, dance, and act. So that's what we have here out of Hollywood. We have but anyway, welcome to the show, Dr. Canizaro. So glad to have you.
Thank you so much. It is such a pleasure to be here with you. I really enjoy it.
Yeah,
I truly do. You're such a gift to animals. We're blessed to have you. Really blessed.
Oh, I just, I was talking to someone the other day about how fortunate I would imagine you feel the same, how fortunate I feel that, and I didn't even know when I was younger, like, what was happening. I just like to talk a lot. And then I have this love of animals. And then I went to college and became, on the speech team. And little did I know how I was going to be able to merge these two things together. And what a blessing it is to find your passion in life. And I know that I could tell that this is what you were born to do, because you're so passionate about it. It's amazing.
I am. And when I found homeopathic medicine in particular, I mean, that was just I knew I'd really come home to roost, to just, a real calling, because it wasn't that I didn't like veterinary medicine. I loved it, but I could feel that it was just flawed, and animals were not getting better. They were not getting well. And it was so frustrating, because
Yeah.
I made such a commitment to help and heal animals, and I didn't feel like I was healing them.
Yeah.
So it just feels wonderful to be able to do that in my day-to-day practice. And I'm blessed just to have the best clients ever. I mean, my clients are amazing. They're just incredible people. So I think that this kind of work really draws those people. I don't know if you find that in your business. Yeah.
I do grooming, so we get people that are just coming to get haircuts, and they probably think I'm crazy. but when I found nutrition, when I understood the difference between, I know what you're saying when you find homeopathy, just like this moment when I nutrition was that for me, where I was like, oh my gosh, that's this key for me when I'm talking to people about their skin problems, was nutrition. That's where I was lacking. Like, I could give them the best baths and I could do all that stuff, but I didn't have that part. So those two things came together. But yeah, I find that holistic minded people tend to be a little more open minded. So they're willing to listen, and not be so feet in the tracks. And I think that's because we all had our feet in the tracks before, or in the, whatever it's called, we like dug our heels in, until you had that aha moment. And then you're like, oh, maybe I should stop trying to be so standoffish. Yeah. And I just can't wait till people I was just talking to my friend. I hope he comes on today. But it was for human. And I told him, you should look up homeopathy. And he said, what is that? And I said, well, I'm going to be on Wednesday night with the greatest homeopathic veterinarian. Maybe we can teach you a little bit. So it made me start thinking, it's been a while since I had Dr. Pitcairn on, and he talked about, what homeopathy is. And then we kind of went with it. But I was thinking maybe tonight we should revisit that, like maybe a little bit more explanation, and kind of we've had new followers since then, because it's been probably over a year since we really gave the explanation of what homeopathy is, where it comes from, how it's regulated, like all that kind of stuff. So
Yeah.
What do you think?
I think what's important too, when we do talk about this, is for the listeners to understand that not just homeopathy, but especially homeopathy, is under attack from your ability as a person to even be able to get homeopathic medicines over the counter. And that's serious, because when the government starts to decide a medicine such as homeopathy, which is actually much older medicine than Western traditional medicine is. And if your listeners can appreciate it, I don't really like to use the word traditional medicine because it makes it sound in some way more inferior or superior, excuse me, the opposite, and homeopathy inferior. And homeopathy really was more or less founded in the 1800s. And our Western medicine or allopathic medicine is really new. And most of the drugs that we use are not well proven, or they haven't really been proven at all. And through your own animals are sort of the experiment as to whether or not these drug medications are safe. And then, as many of your listeners may know, for instance, like the newer drug out now for skin problems called Apoquel, only recently have they had to put on there that there's risk of cancer in the use of that medication. And it. How did they find that out? Well, because enough animals that were taking that drug medication were developing cancer, and they could no longer deny the connection between the use of that medication and the possibility of getting cancer. And the nice thing about homeopathic medicine is that there are no side effects, and we can't cause any harm. And that's the thing that's scary, because when we get into, well, now the government's going to regulate homeopathy and you can't get those little homeopathic medicines at your health food store anymore. If that comes to pass, you won't be able to help yourself with common flus and colds and tummy upsets and, vomiting and diarrhea and headaches and migraines and injuries and things like that with medicines that have been proven honestly through the course of time, and not necessarily through double blind studies. We're going to talk about that maybe just a tiny bit here. Um, and they're so safe. They've never ever caused anybody to, get sick, die, no dangers, no side effects, or anything of the sort. So when Samuel Hahnemann discovered homeopathy, it was kind of by accident, because he got fed up with how Western medicine worked, because back then it wasn't Western medicine. They were using things like mercury to try to kill infections, and then they kind of hoped that maybe they wouldn't kill the patient before they killed the bacterium or whatever it was that was infecting the individual. I want you to take note that that sounds a little familiar, doesn't it? It's like chemotherapy. It's very similar, because chemotherapy is non-selective also, and so when you get chemotherapy, it's non-selective. It kills everything. They just hope that maybe they can give it to you and kill more of the cancer, and that they can salvage, and that maybe you'll recover from the poisoning, essentially, when they give you breaks from the chemo administration. And it was kind of how it was, back in the day when they did bloodletting in Hahnemann's time. And he just thought, this is brutal and it just doesn't feel right to me. So he actually launched into just looking through and reviewing old literature, and found some information that led him, this is the shorthand, to more or less discovering homeopathic medicine and starting to work with it. And back in that day, of course, there were no cars or anything. So, people walked for, hours and days, to get to their homeopath to get treated for whatever ailed them. And nowadays, of course, we're a phone call away, or hopefully we're in your neighborhood. But if we don't support homeopathic medicine, we're not going to have it, and we're not going to have homeopaths, either human or veterinary homeopaths. And I think it's really critical, because it's a type of medicine that, in my hands and in my experience, is the deepest healing type of medication that there is. And it is regulated currently by the FDA. They're trying to reclassify it and move it to a different department, which I don't know that that's such a good idea. So check out National Center for Homeopathy. You can find out information about how you can support homeopathic medicine. It will also give you some general information about homeopathic medicine, and a resource for finding practitioners, especially human practitioners. And it's a good organization to support, and not expensive to do so. So I would encourage you to do that. Also, you can read Dr. Richard Pitcairn's books on natural health for dogs and cats. There's a wealth of information there. And Don Hamilton, another one of my colleagues, also wrote a terrific book. And I'm sorry, I'm going to forget its reference on my website. I recommend that. And a third book I strongly recommend that you read, because it's such an easy read, is Beyond Flat Earth Medicine, written by Dr. Michael Dooley, who's an MD. And it's an older book, but it's a fantastic 100-page read, all about homeopathy and the history of homeopathy. So the principles behind, so I encourage you to read those books. So please,
Real quick, Dr. Canizero, real quick, because I want to try to help get some of the questions answered and also educate people about homeopathy. So we'll kind of go back and forth, guys, because we want to make sure. But one of these questions says, "What do you recommend for flea prevention?" What I'm interested in with that question is there a homeopathic treatment that you could give an animal that would prevent fleas from wanting to be on him?
Well, it's a multi-pronged approach, really. There's not how homeopathy works is we're taking a collection of symptoms that are outside of average for that individual and treating that individual very individually. And so there isn't a panacea homeopathic medicine for heartworm prevention or fleas, ticks. What we have to do is look at the prong approach, because the whole idea about the bugs and the things out there, how do we make ourselves resistant to viruses, bacteria? Because we're all going to, come across fleas and ticks and all of those things. They're going to be in our environment. COVID is going to be in our environment. That's not something that's going to go away. So we are unusually focused in Western medicine on killing the bugs out there, as opposed to knowing how we could actually strengthen and heal the body and raise the body, be it an animal or person, to the highest level possible to resist excessive fleas, excessive ticks, viruses, bacteria, etc. So it's not about killing the bacteria. I had a client call me today about a dog that has advanced inflammatory bowel disease on steroids and antibiotics for a Campylobacter infection. That's a bacterial infection. And I said to her, and I say to your listeners, that it's not about killing the bacteria. If you continue to use steroids and antibiotics, we continue to damage the gut. Well, how did the Campylobacter get there in the first place? Because the gut was sick. And if you have a sick system, you're going to have more fleas, you're going to have more ticks, and you may or may not, and it's complicated in homeopathy, you may be more prone to infections, heartworm disease, or something like that. So, and I say it's complicated because animals that are busy with a particular disease, such as cancer, heart disease, are less likely to get infected with something else, because we essentially have one disease in our bodies at a time. And even if it looks as if there's more than one, let's say the animal suffers from an ear infection and, spleen cancer, those are the same disease. They're manifesting in two different locations. That is a departure from how allopathic or Western medicine views things. So we have to treat the individual. We have to provide optimal diet, very appropriate diet, healthy diet that needs to be specifically designed with the animal in mind, whatever their particular needs are. We're not going to use a high fat and a high carbohydrate diet necessarily for a dog that has raging pancreatitis. And I may or may not use a raw diet for certain individuals that may not be able to tolerate it. So it isn't that I'm against one or another diet. You'll notice that I don't mention a specific diet on my website, although generally I recommend Dr. Pitcairn's diets. And I don't recommend one because it depends. It's a case by case situation. So health is tied to diet, and health is also tied to how are you treating yourself and your body. We need adequate exercise, good sleep, the lowest amount of stress possible. So you need to exercise your pets, even if you have cats. And how are you going to treat your pets? Are you going to use medicine like homeopathy that helps to strengthen the system and bring it back into homeostasis and balance? Or are you going to use drug therapy that damages the system and makes them less likely to be healthy and strong and resistant to many of those things that are out there? So it's a long answer to your question, but it's complicated.
No, it is. That's one thing I found even with me, and I'm not a veterinarian, but people ask me questions and I'm like, God, now that I know so much more about it, I can't answer it quick and easy. To your point, though, I will say I interviewed a wolf expert years ago, and he said that they find wolves because they track them and then they take them and study. And he says when they find wolves, they may have 100 ticks on them at any given time, but what they never have is Lyme disease. So, right, it's very interesting. So like the ticks are connecting onto the wolves, hundreds, he said sometimes, but they've never ever had a wolf with Lyme disease. So that's to your point, that if you're healthy, how does the body resist? because nature doesn't want the tick to die and nature doesn't want the wolf to die. So how do, they just kind of take care
We have to work symbiotically with the organisms that are out there, whether it be viruses or pests. I mean, believe me, I don't particularly, I'm not a fan of palmetto bugs, and they're like dinosaur cockroaches here in Florida. And I'm not a fan of those. We all have symbiotic relationships to play here, and
right,
I'm not a fan of ticks either, or fleas. But we work symbiotically. And in my practice, I don't, generally speaking, I would say the majority of my patients don't have that much trouble with fleas and ticks, and they don't use flea and tick poisons. They don't need to use flea and tick poisons, but of course, that weakens your pet. Then you have to keep using it, and it weakens your pet more, and you keep using it, it weakens your pet more. And then guess what? You're never off of those flea and tick poisons.
right.
Or they get cancer or neurologic disease or digestive ailments, immune system problems, etc. So you're going to get any of those kinds of things that are going to occur because you're weakening and damaging the patient more and more and more as we continue to use those medications.
How do you feel about some of the sprays, the repellents? I like repellents more than I like killers. But how do you feel about like the amber collar, the Kind? There's Wondercide. There's a bunch of like repellents. How do you feel about those?
I personally don't have a problem with them if people need something. Again, we live in an environment where these pests at times are going to be in greater quantity. For those people, I have a lot of clients now, believe it or not, that are doing a lot of mobile living. They buy campers, they sell everything, they're living in their camper with their pets, and they are traveling mobily. And some of these campgrounds are laden with mosquitoes and, maybe ticks. And we're not going to avoid all of those pests. And if you do want to use those topical products, I certainly recommend a lot of those. I personally haven't had much luck with the amber collars. I like them; they're intriguing and they look pretty. But they
They're
didn't
very
help when
pretty.
I had they are very pretty, and I didn't have any luck when I had a flea outbreak on my farm. It's been probably about 4 or 5 years now that we've been really minimal or almost no fleas and ticks, but we did have a rough time for a couple of years there. Maybe it was just the constitution of the pets that I had at the time that weren't as healthier as well. I'm not really sure, but um, I don't have a problem with those, and I recommend them. My partner makes a flea and tick essential oil roll-on. Wondercide is an essential oil-based product. What I would say to folks, if you want to do your own essential oils or do your research on them or whatever, be very careful using essential oils on cats because they don't tolerate essential oils as well as people and dogs do, generally speaking. And please don't go crazy. More isn't better. So please don't. I've had some animals that come into my practice and I can barely breathe because they have so much essential oil in it. Please, it smells nice, but it's too much. Don't go overboard. That's not
Yeah,
healthy either. So please don't go crazy. More is not necessarily better.
that's a good point, especially when you take into account how much more your animals can smell. Like
Mhm.
they're so much more sensitive to that stuff.
Oh,
So
heavens, yes. I mean, imagine them when they're steeped and they're, it seems as if they were soaked in essential oils for a couple hours or something, and
yeah.
it's just necessary and it's not healthy.
Coco has this question. I'm just gonna put this out there before Dr. Canizero answers it. I am about to do an entire live podcast on this subject because it's one of my favorite subjects to talk about. But so Coco wants to know, she says, "Hi ladies, I have a 7-month-old English bulldog. Yay, we love that, right? Because we're
Oh my
bulldog,
goodness, yes.
we're bulldog lovers. So me, I had an
Oh,
English.
totally.
I don't even know where your little pumpkin's running around.
Yeah,
Um,
I think she settled down under my desk. She was in my
yeah.
lap, but she was getting a little restless. So,
So she says her English bulldog's raw fed. She eats small batch. Not sure why she has dark tear stains. I know she was not on the best diet from the breeder. She's my third bulldog, so I'm accustomed to caring for the breed. First off, how old is she? So how long have you had her from the breeder? And then go, Dr. Canizero.
a lot of people ask about eye discharges and ears and nose, but the most common discharges that we're going to see are from the eyes and the nose. And we have to appreciate that these are all draining areas. So if there's anything that is amiss in the system, you could have eye discharges and staining. And just because we're feeding, and I'm not bashing small batch or anything, just because we're feeding a prepared diet, raw diet, doesn't guarantee that one, it's balanced, or secondly, that it's the right diet for your pet, or it may have nothing to do with the diet. My experience is that I'm afraid, sorry to say, that vaccine damage is very, very common for causing tear staining. And diet alone just doesn't fix everything. So if your pet has an imbalance or a collection of symptoms, it doesn't mean, I think she's had her for 4 months. That's not an awfully long time, but don't necessarily expect the diet to completely resolve the tear staining. And it may not be a diet problem. It could be a vaccine damage issue. But the ears, the eyes, the anus, the nose are all drainage areas. So if animals are trying to expel or secrete or discharge, those are the orifices, and we see it a lot in eyes and ears. So don't fret about that, but I recommend certainly contacting a homeopathic veterinarian. We can go over the diet with you, but more importantly, see if there's any other symptoms. There are eye problems that can cause excessive tearing. I don't think that that's probably the problem in your bulldog, but again, I'm not privy to being able to see your bulldog now. But if they do have eyelashes that are directing toward the eye itself, or they have rolled eyelids called entropion, then that can cause eye irritations and discharges. But the tear staining typically is more of a benign discharge that has more to do with vaccine damage, more likely, and possibly diet.
Yeah, there's so many causes of it. It's just so funny because before we came on, I told Lori, I said somebody called me about a bulldog tear staining, and we did this whole talk about it. And then I said, do you want to come on and we'll recreate what we just did? And so we're going to do that. And it's just about tear staining and some of the solutions I've found, and some of the causes I've found as a groomer. But I'll save that for a different time because I want you guys to hear as much as you can from Dr. Canizero, because she's so fabulous.
Oh,
And you're right.
so
There's so many different causes of it. And I also like that you point out that, you know, tear staining could be nothing, but it could be something, right? Like we can't just go, oh, he's just got some tear staining, because he's not supposed to have the tear stains. So, but I
no,
get that as a groomer, a lot of times people want me to put like the whitening shampoo, and I'm supposed to magically make this go away with like blueberry facial. It to me is just an upsell that shouldn't be on your dog in the first place. But
yeah.
anyway, I love that you talk about how you gotta find the cause and then kind of work from there and see. But
We're
for
always going to treat from the inside out. I mean, and again, English bulldogs can have nose roll issues. Some other breeds too are brachycephalic breeds in general, which are the
yeah,
pushing face dogs. If your listeners don't know, um, and there's lots of potential causes. Less likely that it's a mechanical issue like that, but it is a possibility. We don't want to rule that out.
yeah,
And any breed can have unexpected issues. I had a pit bull new patient recently, actually a wonderful woman who her father is a local veterinarian here, and she came to see me for her dog's skin problem. And I said, your dog has entropion. She said, oh, by the way, I've been noticing the eyes, or he has his eyes kind of squinty, and seems irritated, a lot of discharge. And her dog has entropion, which is the rolling of the eyelids. They roll in, and that is most commonly caused by vaccines. So while she didn't do a lot of vaccinations with her young pit bull, there were a few that were done. And a lot of people say, well, I haven't vaccinated for 3 years, so that couldn't be it. But vaccine damage can follow them for many, many years later.
hmm,
And the sad thing is that we could have a hiatus of not vaccinating for 5 years and then have injection site cancer. I've seen that before, or spleen cancers or mast cell tumors or whatever. So we're not in the clear if we just stop vaccinating. So again, working with a homeopathic veterinarian to try to catch any red flags, which are symptoms that collectively help us arrive at the right homeopathic medicine specific to your pet, that stimulates a healing reaction to restore homeostasis or balance in the system, is the aim of all healing and should be the aim of all healing. But that's not how it works in traditional medicine, because drugs are used to stop diarrhea, stop itching, stop discharges, stop this, stop that. And so all we're really doing is doing a band-aid approach where the disease is progressing under the use of the medication. And in addition to that, it's compounded by the drug's disease. And I've said this before, I believe, on your podcast, that side effects is a polite way of saying it's the disease the drug causes to the patient. So you have your original disease, then you have the disease imparted on your animal,
Right.
your beloved pet, with the drug that's being used. And
Right.
that is compounded to a point that sometimes there's a point of no return or an ultimate disease of cancer or whatever. So the disease is going to progress even if the symptom appears to go away by the use of any of those medications, whether it's like Apoquil, Cytopoint, steroids, whatever it might be. It will come back, or all those ear preparations, which I don't know if your listeners know, but most of the ear drugs that are used in veterinary medicine are actually drugs that are toxic to the ear canal.
Oh
So
yeah.
with the
That
chronic
pack.
use, they
What is
cause
that pack
infections.
called? I was just reading about that pack and what it does to the ear canal. I'm like, oh my God. What is that pack called? I can't think of the, you know what I'm
I
trying
you
to.
know that's yes. It's newer in the veterinary market. I've been a homeopath since the mid 19
Yeah, it's a
1900s.
newer one. I didn't know
So it's a
about it
newer one, and
either.
I've heard of it. I know clients that have used
It
it or
ruptures the eardrum. That's one of the, like, it can rupture the eardrum. I'm like, oh my, okay. All right.
all of them can, because remember, they're ototoxic. They're toxic to the actual structures of the ear canal. And heaven forbid if you have a breach of the eardrum, then it's especially toxic to the inner structures of the ear. So, and I've seen lots of side effects with those, but no matter what you use, if it's that ear pack stuff, I'm not sure what that, I can't remember what it is, but it's a bunch of drugs and steroids too. And that's packed in the ear, and you leave it in, you don't take it out, you don't rinse it out. Um, and it's just as dangerous as all the rest of the stuff. It might even be more dangerous. I just don't know. Um,
Yeah.
but in as much rescue work as
Thank
I've
you,
done,
Sherry. So
I,
I was saying thank you because she put something up. Sorry.
oh,
I didn't mean to interrupt you.
no, that's fine. And but as much rescue work as I've done, there's so many animals that come in with like really chronic, like calcified ears and narrow canals, and they carry on about the dog's ears being neglected. But that's not necessarily the truth. It could have been that the individual was like over treating through the veterinarian, I mean, not themselves,
Right.
over treating for these chronic ear infections,
Yeah.
because that's what these ears look like if you keep using those drugs.
Yeah.
So it's kind of the opposite. And I'd be sitting there going, oh, whatever you say, I know that's not true. But and sometimes people get blamed, or even clients will be made to feel really bad about how their dog's ears look.
Yeah.
So yeah.
Yeah, and sometimes I know, you're welcome, Lily. Yeah, I use, when people ask me, I I think people are over cleaning their dog's ears. Like, I think it's just, I mean, to think that you need to be in there cleaning
Absolutely.
your ears and putting that stuff in your dog's ear canal drives me crazy. So I always suggest to people, if you feel like you really want to clean your ear, just a little bit of coconut oil and water and like wipe them out. But don't be jamming stuff down in their ear canal and stuff. So I'm glad that's working for you, Lily. I
I
wanted to,
want to I want to piggyback on that a little bit, because I think that your listeners could really benefit.
yeah,
I want you to think about the ear canal almost like the gut in a way. If you keep flushing,
I just
cleaning,
said that.
flushing, cleaning. Oh, did you? Oh, I'm sorry. Did I
Not
miss
not
you?
this trip. No,
Oh,
not
yeah,
this time.
you
I just said that
did.
like 2 weeks ago to some people. I'm like, think of the ear as
It's
the gut.
true. If
Yeah.
you keep cleaning the ears obsessively, then you're going to damage the normal flora in the ear, and you're going to advantage one species over another, and maybe yeast, maybe this type of bacteria. So they need to work in harmony together, because you're going to have some of each always in the ear anyway. We could culture an ear and get something out of it. So think of it that way. So don't obsessively clean. Maybe a little bit of coconut oil. Just do a wipe on the outside if they're a little bit dirty. Don't go
Yeah.
crazy. The only time I have clients doing anything inside the ears is if the patient is miserably uncomfortable and it soothes them to have the ears cleaned. That's okay. That's fine. Then we can go ahead and do that, at least short period of time, temporary period of time. But I never prescribe, recommend, dispense any ear drugs or oral medications for ear problems. I,
That's
I can't.
amazing. I bet there's
I've been doing this since what, 1995.
yeah,
I have not yet prescribed drugs or antibiotics. I mean, when I was working in other people's practices and covering for them, I did what I had to do. But in
right,
my
right.
practice, I have not. I've never done that.
It's amazing to think. I bet there, if a million people could listen to you say that, they're probably like, well, that could never be. Then all the dogs would have ear infections. Like, they would probably think that means that dogs just, I mean, so many people have accepted the fact that, well, it's not a fact. They've accepted being told that dogs just get ear infections. And it's
Well,
just,
today I did an annual checkup on a wonderful client of mine who has a number of dogs, and one of their dogs is a aged. I'm not sure if he's 19. They're not sure how old he is because they got him from someone else. But I think he's like 19 or 20-year-old basset hound. His ears are beautifully clean. They don't clean them. They don't wipe them out. They haven't had to be treated, and I've been treating her dogs for a number of years now, and they never have to do anything. So to say, well, yeah, but I have a cocker spaniel, or I have a basset hound, or I have another kind of hound, or whatever dog you have or breed you have, oh, they always have to have their ears cleaned. It's just not true. It's
yeah,
absolutely not true.
yeah, I
And so
agree.
don't fall for that. Please
And they
don't.
start them off as puppies. So I'm like, oh man, like
Yeah,
you
here's
walk
your ear
out of
cleaner.
the, yeah, you walk out of the vet with a 2 month old puppy with ear cleaner. And it's
Oh,
just, I'm like, oh my God, we're just setting these guys up for total
not
failure.
in my practice. You don't.
I
So
know. I've said, how do I get you to move to California? Like, we kind of have the
I
same
don't know about
weather.
that. Kind of. Yeah. Well, I don't know. I don't think I want your earthquakes though. I think I could do without that. But then again, we have hurricanes, so pick
I'm
your
like, you guys
poison,
have
right?
hurricanes and sinkholes.
We have sinkholes, but I don't think I don't know. I don't see
Okay,
it
okay, but to
in
be fair,
overabundance.
like you guys have alligators. Like I like that is like
Well,
that.
I haven't been in a while, but I used to kayak, down like the Hillsborough River, and we would see alligators. I mean, if you don't bother them, they don't bother you.
I
They
think they're
don't. They'd
cool.
be all over
I
the
think
place.
they're
They're
cool. I
really
got to
cool.
hold a little baby
I will
alligator,
say though, don't let your little dog go near all those
but that's
waterways
where
with
I
the
would be
alligators. That's
scared.
not a
Is
good idea.
that's where I'd be scared. Is that I don't know. I would just be so
Honey, I'm on
scared.
high dry ground, so we don't have any alligators.
Oh,
We
you
got
don't?
plenty
Oh,
of
okay.
fish, no
All right,
alligators.
then you can
So when you
stay
come and
there. But
visit, you'll be safe.
Lily asked this great question. It's one of my favorite questions. Where was it? It was on, well, I'm just going to kind of say it. So, can we overdo supplements? Oh, there it is. Can we be giving our pets too many supplements? Your thoughts? This is one of my favorite
Yes.
questions.
Absolutely. Absolutely, you could be giving. My opinion in the universe is the more that we can provide the necessary nutrients for your pet through real, whole, wholesome food, the better. I do typically recommend or dispense like a multivitamin, multi-mineral, and I will use supplements, but I use them targetedly. So if I have patients with certain ailments that I might want to give them a little additional support in a particular area, I may use some supplements long term or short term.
Yeah,
But yeah, absolutely, you can overdo supplements. And Lily also asked a question I think is super important, if you don't mind my addressing it.
please.
She asked a question about what do I think about probiotics and should you rotate different brands? What are my thoughts on that? That is a fantastic question.
Yeah.
And the gastrointestinal system is very complicated. And I was listening to somebody today actually online that was talking about your gut being the second brain. Not that that was new to me or anything, but and it's quite interesting because, of course, gut problems can lead to behavioral problems and vice versa, whatever. But my point here is that the gastrointestinal system is complicated. And depending on where you might have damage or depending on what type of imbalance you have in the gut, probiotics may be of absolutely no use whatsoever. So, probiotics are going to just go in your system and hopefully feed the good bacteria. But if you don't have that good bacteria, then it doesn't even matter if you're using probiotics because they're not going to do anything. So it's important to understand where the ailment is in the gastrointestinal tract, what you might be dealing with, and use more targeted supplementation for that to heal the gut. And obviously, with homeopathic medicine, I'll sound like a broken record, and proper diet so that we can address healing, building, and healing the gut. But probiotics are not going to heal the gut. And they're okay to use and they don't offset antibiotics. That's sort of like bringing a forest fire, bringing a pail of water to a forest fire. So if you think you're going to be all right, or your vet is great because they dispense, you know, probiotics from Purina, along with the whole script of antibiotics, you're damaging the gut. So we have to fix the gut and build the gut back up. And probiotics is not going to offset that. And it may not help at all, or if it does, it'll be maybe nominal help. I'm not saying you shouldn't do it. It's better than giving nothing. But just understand that that's not going to be the panacea. oh, I'm not going to worry about it. My pet just went on antibiotics for a urinary tract infection or inflammatory bowel disease. And the new patient that I just booked today, not for today, but for a month out. Anyway, she said, well, I am using probiotics, along with the fact that my dog is weaning off of steroids and is still on antibiotics. And I said, well, you can continue if you want, but it's going to be a pail of water to a forest fire. So we have to get in there and work with your homeopathic veterinarian to determine if what you're using is even going to make sense to use.
Yeah, it's a really good point that you make, because I'm seeing this a lot now because probiotics are so all over the place. As people, I tell them, I don't think you need an antibiotic for this, and they'll say, "Well, it's no big deal. I'll just give them the antibiotic, then I'll give them the probiotics."
Good
And
luck.
I'm like, "Oh, you have no idea.
Good
Like, you
luck.
really need to know." Especially, I'm seeing people get on antibiotics for little tiny cuts and scratches on their dogs, like little.
Absolutely. There
I
was a
mean,
study done, and I don't recall who it was, but I think this is important to mention that just a 5-day course of this was a study done in humans. A 5-day course of antibiotics damaged the gut for up to 2 years. It could take up to 2 years for your biome to heal and get better
fix.
again.
Yeah. Because
Okay.
what we do know about probiotics is even
That's
if you're
5 days, folks. How many times have you gotten a prescription for 7 to 14 days or 3 weeks? Because if the problem doesn't get suppressed sufficiently in 7 days, now they're prescribing medications for more like 3 and 4 weeks.
yeah,
So
wow.
just think about it. That's a long
Well,
time.
we also know that a lot of those probiotics aren't even surviving through the gut, like getting to the gut and surviving there. So you can take all those probiotics, but you killed
Well,
off
they
so
may,
much.
yeah.
If you get like what 1% might get in there, yeah, we gotta just stop overdoing. I just had a client today. Um, this one makes me really angry because I'm so positive. I can't wait to get a text from her that this mark was a vaccine mark. So those marks that the dogs get when they get shot and then the hair falls out and then it grows back dark and whatever, if it grows back at all. So that happened to her dog. And then I was talking to her about flea and tick medication because we're going to try to fix this dog's gut. And because he's been on, having this cycle for a couple of years now.
Wow.
So, but she says, well, the only time he was on NexGard was when he got mites. And I'm like, your dog got mites. Where did your dog get mites? So we start talking about it, and it's the little, I don't know, she just got this little patch right here on her hip and she lost all her hair. So they told me it was mites and gave her NexGard. And
Ooh.
I'm like, did they run a skin scraping and check? They didn't. They just gave her NexGard. And I'm like, gosh, dang it. And I'm waiting. She's going to go home and look at it. Was just right before I got here. I said, go home and look and tell me when that vaccine was given and when that patch showed up. Because I bet you it's within a month, maybe 2 months. It'll be. So anyway, it's frustrating to me when we don't even know why we're giving something. We just throw it out there like, oh, we'll just give it some antibiotics and see if it works.
Well, I know I've mentioned this before, and I'll say it again because I think it's super important. I understand that sometimes you want to go in and to your vet and you don't want to spend the money on the diagnostic tests, whether it's a skin scraping or blood work. Um, just get it done. I mean, the veterinarian is treating in the dark, and sometimes they elect to do that on their very own. And even when a client is absolutely would really like to have the proper diagnostic test done and within reason, not invasive. I'm talking about blood work, skin scrapings, things that are non-invasive. And the use of medications when you have no idea what you're treating is downright dangerous. Even using NexGard, because of course
Yeah.
we've seen some terrible things occur from the use of NexGard,
Yeah.
neurologic problems and seizures and paralyses, death. I think we're going to see more like side effects on their list of medication when they come to consciousness over it, or forced to, I should say, because usually it's not voluntary. Um, Understand one, be aware, be willing to get diagnostic tests done within reason, and then
Yeah.
ask why for a certain medication.
Yeah.
How do you know it's mites? Ask questions. You have a right to ask questions.
She wouldn't
If
had any
any
idea.
drug is going to get used on your pet, whether it's
Yeah.
antibiotics, steroids, Cytopoint, Apoquel, vaccine, I don't care what it is,
Yeah.
Ask if this is necessary and why, or why do you think I need this? How many dogs go home, get a blood test, and have a normal complete blood count and are told that their pet has an infection? I don't know too many infections that have a completely normal white blood cell count unless you have a viral infection.
Yeah.
Then your white blood cell count will either go lower or will stay in within the normal range. It's just not usual unless you just don't have an immune system that reacts to anything. It doesn't make sense with a normal white blood cell count. And I want to bring that up too, because you could have an elevated white blood cell count that is not an infection, it's an inflammation.
Hmm.
And I think that's an important distinction as well, because you could have an elevated white blood cell count. That's what your body does when you have inflammation. But just because your white blood cell count is elevated doesn't equal infection. You might have inflammation in the absence of infection, or you might have inflammation with infection. So if you don't have a fever and the animal is acting okay, and you can also have an elevated white blood cell count with stress. I don't know too many animals if they had pain or anything like that, or were terribly anxious having a blood draw, or terribly anxious in the veterinary office, they're going to have an elevated white blood cell count. I got news for you. It's not an infection. So, and vets don't think about that. They're just going to call stuff whatever, whatever, or they won't do the tests, or they'll dispense medications. I've said this before on your podcast. It's so critical for you to be an advocate for your pet and use common sense the best you can. I'm not expecting you to be a veterinarian, but I want you to look after your pet so that you aren't necessarily just turning your whole world around to the veterinarian, do whatever you want with my pet. Because I don't think we can any longer really just trust your average allopathic veterinarian to necessarily think through things. In fact, I would propose that more veterinarians are not using their brains and they are not problem solving. They're
Yeah.
not using logical thought processes and their skills, their sense skills to even help diagnose the pet. They just give you a whole list of things they want to do.
Well, that's a perfect example. I mean, have you ever seen mites just go right there on the hip in a circle? Just right there, just nowhere
Well, that's
else.
a hard question because demodectic mange can show up as spots. It sometimes it's only one spot. It's usually not a
Yeah.
perfect circle, but uh, and ringworm can be a circle. But
Yeah, ringworm, but
again,
they didn't run any tests.
you have to do skin scraping or testing
Yeah,
or black light or
they didn't do
culture.
that.
Well, they
And by
should
the
do that.
way,
I
I
call that bad. I call that bad medicine, and I'm going to
it's
say
totally
it
bad medicine.
freely on your program.
She just texted me, and as I thought, on 3/8/2022, she had 3 injections. Rabies is one of them, and on 6/14, she took her back because of the spot on the hip. It's what I told her. It'll show up in a couple months.
Yeah.
So, and I don't know how long she saw the spot before she felt like I better go to the vet. I have no idea. But yeah, and it was a rabies vaccine. And instead of them actually doing a skin scraping, that is such a good point, what you said. And all we have to do is say something as easy as, how do you know it's mites? How do you
Right.
know it's an infection? That's it. How do you know it's an infection? We don't have to challenge or be a jerk. We can just say, oh, how do you know? And
Your
then,
best bet is not to be confrontational because
right.
the veterinarian doesn't like to be questioned. Some do. I don't mind being questioned. It doesn't bother me. I want this in my practice. I feel my work with my clients, their fur babies. This is a partnership. It should be a partnership.
Yeah.
The pressure in veterinary medicine and allopathic medicine is to see patients like every 10-minute appointments, every 15 minutes, and they got to get in and they got to get out. But too bad. If you're paying an examination appointment, you're paying for the veterinarian's time and you deserve to be able to have your questions answered. If they're not adequately answered, then don't give the medication. If it's a life-saving measure, then you really better ask the question. You better really press. Most of
Right.
the time, the recommendations for medications is not life-threatening. It's not life-sustaining. I want to give you another example that drives me absolutely crazy in my practice. I don't know how much you might see of this, Carrie, but me as a veterinarian, I see it all the time. As soon as a pet is found to have a heart murmur, they go on a triad of medications for heart disease.
Yeah.
They don't get a heart workup. They don't get an echocardiogram or blood work or anything like that. And they go on a nalopril, which of course can damage the kidneys. Sometimes it's used for kidney disease, but I would argue, since I used to do renovascular hypertension research, not me personally, but I assisted in that. that's a bad idea. It's not good for the kidneys to restrict blood flow to the kidneys. So they put them on that, and they put the dogs on expensive pemabendin. There's no reason to, if the pet is asymptomatic, it's critically important to say, okay, well, there shouldn't be a heart murmur, so we should do a cardiac workup.
Right.
Would you ever, like accept your doctor just putting
No.
your mother or your spouse on heart medication without ever having the heart worked up? Why would you
Yeah.
do that? And
Yeah.
it probably still won't be necessary anyway. But so I see these dogs come in with these medications and they haven't been diagnosed. Furthermore, it's important to distinguish between respiratory disease and heart disease. Many dogs will go on all kinds of heart medications because they assume it's a heart problem, but the pet really has a lung problem. And so the lung problem, and again, I don't espouse to any allopathic medicine anyway, I treat them homeopathically. So why would you just go on medication on a guess for any reason, especially anything serious? Even that, well, I would argue the next dog.
I've had veterinarians well, I wouldn't say misdiagnosed, but one vet will listen and say this is a heart murmur grade 3. The other one will be like, oh no, this is like, so you really do need to go in there and get some pictures, like you're saying, like just having someone say there's a heart murmur, and get a couple of opinions, because I've seen it all across the map.
And some heart murmurs are transient. Like I might hear a heart murmur in a particular patient. Maybe they have a little something going on or some early valve changes. And then I'll treat them. And then maybe an appointment or two later, a month or two later, we're going to listen again. And if the heart murmur isn't present anymore, you don't necessarily have to go and have a heart workup done. But the other thing
I didn't know they were transient.
The grading heart murmurs is a little subjective because it depends how good your stethoscope is. And, I have some stethoscopes that are better than others. I can hear better than others in them. But, we'll be a little subjective, but we're going to usually, most good veterinarians are going to be in the ballpark. I mean, if it's a grade 2 or 3, I might call it a 2. Somebody might call it a 3, and it might vary. Like some days it might be a 2, some days it'll go to a 3. But
I did not know that.
If a dog has a grade like 5 out of 6 or a 6 out of 6 heart murmur, I think we're all going to agree it's a grade 5 or grade 6. I mean, because that you yourself are going to feel when you touch your dog's chest. It's going to feel like rumbling.
Can anxiety increase the sound of the murmur? I mean, it should, right?
Sure. Yeah, absolutely it can. And it can even potentially create one.
Yeah.
And it brings me to another topic that I think is really important for your listeners, which I know is like off the topic of homeopathy. So we'll circle back as soon as you get, direction.
We are going to circle back because this one question from Lily, because she's going in to get a rabies. So we're going to have to address that. Don't worry, we will, Lily, because that one's important.
So I want your listeners to listen carefully about the newest, greatest drug that people love, that veterinarians love to put animals on, and that's blood pressure medication. Please think long and hard about putting them on blood pressure medication. How many people do you know that go into the doctor that don't have an elevation in blood pressure just going into the doctor's office? Look how anxious our dogs and cats are going into the vet office. Do you honestly think that their blood pressure isn't going to be increased? And I would argue that we're not even clear about what is average blood pressure for a dog and cat to begin with. How do you measure that? Whenever we're going to measure it, it's going to be on animals that are already anxious.
Freaking out, yeah.
It's unless you do it at home, and that's why your doctor
do they have
do it at home, which we don't really have good methods to be able to do blood pressure at home in our pets currently, but that's why your doctor tells you to monitor your blood pressure at home, because they know your blood pressure is going to be higher when you're at the doctor's. That is not a reason to put your pet on blood pressure medication. So please don't do that.
That's a good
point. We don't really have a good workup for blood pressure. Let's answer.
Lily, she's taking her dog in for the rabies vaccine because, by law we have to. Her dog's 9.5 years old. She wants to know, do you recommend any pre-treatments before and after? She has some knowledge of, it looks like, of some homeopathy, but do you have any recommendations for her? What can she do? I know she doesn't want to do it, but we have to.
I know we're on a podcast, so one always wants to be careful about what one says, right? Especially when you're a veterinarian. Nobody can make you get a rabies vaccine for your pet. Some people feel compelled to, quote, have to do it because they're traveling, boarding, going to doggy daycare. I'd say maybe you could find one that would be okay with you without you getting a 9.5-year-old dog. That would be concerning. I mean, I don't know how many rabies vaccines your poor pet has had. I don't know what state you live in, but my state of Florida will allow an exemption letter by a licensed veterinarian if we feel that it's not in the pet's best interest to get the rabies vaccination. I won't abuse writing the exemption letters, but it's hard for me to imagine a 9.5-year-old dog isn't going to have something that would enable you to get an exemption letter if your state allows that to happen. I would investigate that. There's no rush. Most of the counties and most of the states are rather patient about the rabies vaccination. Some people travel or have illnesses in the family and they can't get to the time that they're due. So they will go ahead, even if it's the fourth shot, it's kind of like Russian roulette. Where's the bullet in the chamber? Like, which chamber is it? I don't know. Maybe it's going to be the fourth or the fifth chamber. By the time you get a rabies vaccine, that you're going to have a major problem. I would have concern about that. I would consider doing a titer. I would consider trying to find out about your local laws to see if exemption letters are allowed.
Well, she could
Or
look at exemptions, but she already knows Virginia. As far as I am up on this, I know Delaware is the only one that you can use a titer for, and she lives in Virginia, it looks like. But in the event that she ends up needing to do it, is there anything you can recommend for her for like the best type of vaccine to get,
well,
how to do?
I would detox is a misnomer. I really hate that word, honestly, because it's not the only way to deal with the ill effects of a vaccination is to know what symptoms you have after the administration of it. And I know that you've had some other people on that have talked about various homeopathic medicines that can be used. The more common ones are Thuja and Lysin or Lysin,
Right.
Lys. Um, I'm sorry, I can't even spell
Yeah,
tonight.
she has those. She
But
says she has two of
I-
those.
if your pet doesn't go into that homeopathic state after the rabies vaccination, then those may not be indicated. It might be a completely different homeopathic medicine that's necessary to treat. There's no such thing as detox, and if there really were, then our animals who are getting treated over time correctly and well wouldn't necessarily go on to develop cancers later on if we were successful at detoxing. We need to be successfully at treating what we can see to treat. And if there are no effects of the vaccination, no lethargy, no swellings, no hair loss, or hair color changes, or behavioral changes, or itchy skin or diarrhea, if we don't have any symptoms afterwards, and I would look closely for symptoms, or discharges, return of discharges of any sort, eyes, ears, nose, anus, like we talked about before, then it might be hard to sort of, you can kind of guess at it and say, I don't know, should I use Thuja or should I use Lysin? Some people will say, well, it's a rabies vaccine, I should use Lysin. That's not necessarily true. Thuja might be a better choice, or there could be a completely different remedy necessary. So I always tell my clients personally that if they must get a rabies vaccine, most of them don't. And I have had clients in Virginia, so I do know for a fact that people have gone without rabies vaccines in Virginia. Um, I'm just going to say that. I'll put that out there. So you've had some good clients that have managed not to do that and still be able to go into their local veterinarians for some of the needs that they've had. I don't know where you are in Virginia, but so look at your options. I don't know the compelling. I don't think anybody's going to come knocking on your door with regard to vaccines. I think the hardest thing for me is that I view my pets as my children, and I wouldn't want to do anything that could be potentially harmful for them. So I guess I'm a little more inclined to buck the system in the sense to say I'm afraid to give those, or I have legitimate reason not to, within reason, and just say I'm not comfortable with that. I'm not going to do that. So um, I don't know what kind of veterinary homeopathic support you have in Virginia. You could check theavh.org to see if you can find a homeopathic veterinarian in your area. They may be willing to write an exemption letter for you. I think there's I don't know. I know a colleague or two in Virginia, but I don't know if they're still practicing or not. But if you checked theavh.org, and I'm sorry to be kind of evasive, I'm just really uncomfortable with saying, oh, don't worry about it in a nine and a
Right.
half year old dog.
Right.
I'm seeing animals dying of cancer at 6 years old. I just treated a Doberman for osteosarcoma of the right rear leg, had to have an amputation, and I'm treating him now. And he's damaged from the surgery. He's had behavior changes, and he actually like growled and lunged at me. And he had some anxiety and a little bit of instability before, but it's just much more pronounced now. So we just can't say, well, we don't have to worry about it. They're still pretty young. And 9, in my opinion, is young. That's middle age.
So there's a couple of different types of rabies vaccines. Is there one that you would say is safer than another? I
Not
know.
really.
I know.
No.
It's like saying this kibble's
I
better
mean,
than that kibble. I get it.
if it's absolutely compulsory for whatever the reasons are, I always tell people to make sure you get the longest duration. The longest duration vaccination, like in Florida, they accept a 3-year vaccine if it's
Right.
licensed for 3-year use. I always recommend that because then at least we're only doing it once every 3 years. In cats, they do have a vaccination that doesn't have adjuvants, which is some of the poisonous preservatives. Um, but the problem with that is it's only licensed for 1-year use. So it's a
Um,
tough call because do I want to use the one that doesn't have the additives in it, but it's only licensed for 1-year use? Or do I want to risk it and go ahead and give the 3-year so I don't have to give my cat? Although people with cats maybe get away with not rabies vaccinating more easily because a lot of cats I think are indoors. Not all of
right.
them, but a lot of them are indoors. They don't go
Right.
anywhere.
They don't go
They
to
don't.
doggy daycare or boarding or grooming or yeah, yeah.
I mean, maybe your long-haired cats do, but most people don't bathe their cats. They don't take them places and
Right.
parks and some of them don't even take their cats to the vet.
You know
Which
what's
I would
interesting
tell
about
you,
that is I think in general cats are other than the fact that they're almost always gonna not I shouldn't say almost always, but they usually end up with kidney failure at the end of their life. But during their life, cats back when I was a vet tech, we saw dogs constantly with health problems, but not the cats. And then when you look at it, it's like, well, maybe because the cats aren't getting over vaccinated and over medicated and they're home, they're less stressed. I don't know. It just seemed like the cats didn't have nearly as many medical problems as the dogs. So,
that's changing a lot, and I think what's reaching into the cat homes even more prominently is the fact that our diets are so poor. Dry food is so bad for cats and will
yeah,
promote kidney failure
yeah,
that eventually these diseases catch up. They have digestive complaints. And, a lot of vets have also accused away, like, hairball vomiting and, oh, cats just do that. And I mean, maybe they should throw up a hairball like once or twice a year, maybe
right?
3 times a year at most.
Yeah,
It's not
right.
average for them to
Yeah,
throw up hairballs. So I'm seeing a lot more cats with really serious digestive problems, diet
really.
problems, or appetite problems. Some with skin problems, some with autoimmune diseases, and certainly renal disease or kidney disease. But I want to tell your listeners that it's almost a guarantee if you have a cat that has urinary problems or urinary blockage, it's almost a guarantee they're going to have kidney failure later in life.
Yeah,
And
yeah,
vets will never tell you that, but from an understanding from a Chinese medicine perspective, it's still a chronic disease if they have urinary blockage or cystitis or
sure.
UTIs, whatever you want to call them. It's still a problem, but because we're still talking about the genitourinary system, they will develop kidney disease later in life if they're on those prescription diets or if they continue on their poor diets or they continue to get vaccinated because urinary blockage is either neutered too early or it could be improper diet or it's vaccine associated disease. It's going to be one of the three of those or a combination of all.
So sad.
Yep. And that's an expensive, dangerous, life threatening disease for cats.
The three
Male,
years rabies
male
with the
cats. I should say male
thermocytopenia.
cats
Yeah,
in particular. Yep. Male
yeah,
cats in particular. But don't expect your allopathic veterinarian to, agree with the things that I'm saying this evening. It gives you an education and a different perspective.
yeah. Yeah, I think that's why we're here, is to try to just give people a different perspective so that they can feel a little bit more empowered when they go to their vets. That's why I bring you guys on, is because a lot of times when I'm talking to people, like, I get it. It is not going to be a smooth, easy conversation when you go back to your veterinarian and say the groomer said.
Yeah.
So, but if you, so that's why it's just so amazing that you come on here and you're willing to kind of empower people so they feel a little bit more comfortable. Well, this vet said, right?
Yeah.
So I just,
Only a little bit better. There's several things to consider when we are talking about vaccinations. You have the actual physical things that are in the vaccination, which would be the additives and the preservatives and things like that that could be directly cancer causing or could cause seizure events or whatever. So you have that. But the other thing that is underappreciated, and I as a homeopath see it all the time, is the energetic effect. So every drug and every vaccination has a physical effect and it has an energetic effect. The physical effect is the thing you might see more immediately, like the post vaccination meningitis, where the pet either has seizures or they're dull, or they're, a little out of it, or they're very lethargic. And that wears off, and you go, ah, phew, okay, I'm safe. The energetic effect can last months, weeks, years, or the whole life of the pet. And that could be any behavioral changes or latent diseases that show up later that you don't understand where they came from, like bowel diseases, cancers, seizure disorders, dementia, behavioral changes, all kinds of things. And behavioral changes sometimes will occur more soon after vaccination because it's part of the physical change that can occur. So we can't get rid of the energetic effects so easily. So you could talk about a thimerosal-free vaccination, but it doesn't mean it's therefore then safer. It depends. If the patient is energetically sensitive to that medication, it doesn't matter whether there's thimerosal in the medication or not. They're still going to have a tremendously negative impactful effect. So I know that that's not talked about in allopathic medicine because they don't understand energetic diseases. But as a homeopath, we're treating energetic diseases, we're treating physical diseases, we're treating mental, emotional, and physical diseases on all three planes. And that's really important. So,
I'm sorry.
uh,
I'm reading what Dina Owen says,
yeah, I was sort of trying to read that too. Yep.
that that is our, I would say, I know for sure Dr. Canizero and I have talked about this before, and it is something that just infuriates us both. Because it does say, you're right, like, do no harm, and then you want me to vaccinate a sick animal. It's mind
Well,
blowing.
I want to give you a quick example because I have a client, a dear client, who has a 22-year-old cat I've been treating for many, many, many years. And she lives about an hour away from me because she lives in Orlando. And we've been trying to find a local vet that she can get fluids under the skin for her cat because her cat is in a fragile place right now. And I actually had a conversation with the office manager at one of the practices, and they wanted me to call in because they wanted to verify an up to date rabies vaccination. And I said to her, I said, are you serious? I said, she's 22. She's like nearing end of life. We're trying to help her be comfortable and stabilize her the best we can for whatever time she has left. I said, if your clinic forces this client to have a rabies vaccine for her cat, it'll effectively kill her cat. She said, oh, I understand it's not ideal or anything, but it's our policy and we have to look after our techs. Her cat does go outside in her yard, I'll give you that. But her cat goes outside in her yard when she's home and when she is there. I'm certain that she would notice if there was an animal acting oddly in her yard and she would hurry up and get her cat inside, which has not happened. The chances of getting rabies from a bite from her cat, and I'll agree, her cat's fractious. I've handled her cat myself. I get it. But nonetheless, the chance of getting rabies from her cat is almost zero. And that policy, at the risk of killing her 22-year-old cat, it defies logic and is bad medicine. I called it bad medicine to the office manager who had the nerve to treat me as if I was somebody off the street.
Well,
And
it's
not
just so stupid anyway. You're going to give that rabies vaccine right then and there in the office and then treat the cat. It didn't take anyway yet. So you still weren't protecting yourself from the
That's
so-called
absolutely
rabies
correct.
Right.
Yeah.
You still weren't going to protect yourself from the so-called
Well,
rabies that you
I
think
don't
you're
think
going
they
to
were
get.
going to have to worry about doing subcutaneous fluids because I'm almost certain that her cat would not survive a rabies vaccination. And I said to my client, I'm so sorry. You're going to have to find somebody else locally because they're absolutely like, practicing bad medicine and
Yeah.
requiring something that is so against what should be done for your cat,
Right.
that
It's illegal.
it doesn't make any sense at all.
No.
Somebody was asking a really good question here. I think it's Lily again about her cocker spaniel being fearful after rabies vaccination.
I've seen
Lily,
that so many times.
that's an exact example of the energetic disease state that your dog is now stuck in from the rabies vaccination. So I can guarantee you that additional rabies vaccinations will cause more damage,
Yeah.
to your dog's, behavioral change as a result of the vaccination.
Yeah. I know. I agree. I've seen it so
But it
many
is
times.
treatable with homeopathy. I want to say that so it's not all, oh my gosh, now what am I going to do? We can't guarantee treatment outcomes, but that is treatable with homeopathy. But there is no treatment in allopathic medicine for this kind of vaccine damage, or
And
really most vaccine damages.
nobody will believe that. So you can't go back and go, well, last rabies vaccine you gave me turned my dog vicious. So now I don't want to give them, they won't
Tell
believe
them
it.
anyway. Tell them anyway, because
No, I think you should tell them, yeah.
the louder you get, the more likely sometime down the road it will get reported as an adverse vaccine event, because
Yeah.
veterinarians are reluctant to report vaccine adverse events. They should not be, but they are. They don't feel like it, don't believe it, or
Right.
they're afraid that it'll tie them to the damage and that you might sue them. So it's tricky, but talk about it in a polite, good way. Gosh, I'm too scared to give the rabies vaccination because last time I had it done, my dog became more fearful and sensitive to noises. And I don't care if the vet tells you it has nothing to do with that. I get in their ear anyway because
Yeah.
they need to hear it, and they need to hear it from you. And it's about time we as veterinarians listen to our clients, which is why you're going to love a homeopathic veterinarian, because we listen to you and we hear you about what's going on with your pets, and we need that information to prescribe accurately.
Yeah.
It's
Yeah.
it's incredibly important. So
Where, so why is there no reporting abilities at the Board of Veterinary Medicine? Why can't vets get reported? Animals aren't important. Um,
I don't understand her question.
she where
Um,
like can she where can she report?
she
Do you
need
know?
an adverse event needs to be reported to the veterinarian that gave the vaccination. You
But
may
isn't there like
also
yeah, go ahead. The reporting
you
agency.
can also request to gain the information of the type and the manufacturer of the vaccination that was given to your pet, and you can report it yourself to the vaccine company, the corporation that makes it. I would encourage you to do both because a veterinarian might not report it. The Board
Right.
of Veterinary Medicine doesn't care because they're going to follow allopathic medicine principles.
Yep.
And if another, like I said to my client, I'm not going to say she wouldn't have a case, but let's say her 22-year-old cat got vaccinated for rabies and then got sick and or died. She said, I would have sued them. And I said, it's possible you might not have prevailed
Yeah.
because quote unquote, her cat was due for a rabies vaccine. But I will say in the state of Florida that we are entitled or able to write an exemption letter, and her cat would absolutely, qualify for that. So could the other veterinarian argue, well, her cat's fractious and her cat bites, and so we were nervous and afraid? Then they can decide to decline treating that cat. But to force somebody into a medical procedure that is ostensibly dangerous for her cat is outright bad medicine, period. They could just say, I'm sorry, we're not comfortable. Your cat's not updated on a rabies vaccine. We're really not comfortable with working with you and your cat. We'd love to, but we're not comfortable doing that. And I understand it's a real risk to give that rabies vaccination to your cat. Perhaps you could find a clinic that might be okay with working with your cat without a rabies vaccine.
Yeah. All right, guys. We are coming up on the 5:15, and I feel so bad because it's so dark at your house at this time because you're
Yes, it is. And
I
I have
always
all the lights on that I can have on. I just put
I know, but
everything
I can
on to put on.
still tell how dark it is back there, and I
It is.
feel so
It's really
awful
it's
keeping
pitch
you so
black.
late.
Yeah,
But
no worries. It's
thank
my
you so
pleasure.
much being here and all this valuable information. Really quickly, I know somebody had asked if we had mentioned about the flea and tick stuff. Yes, it's in here, so you might want to go back a little bit. We can talk about it. Dr. Canizero gave a really good explanation of that. Lily was able to put on there about the garlic, which I have had great results from. That's what my dogs get every day from fleas. Wow, we just went over the whole gamut of things, right? Like,
We did. We went through a lot. Somebody asked a question about puppy vaccinations. I would
oh yeah,
either read Dr. Richard Pitcairn's book, because I don't want to keep Carrie on too late also, or you're welcome to do a phone consultation with me, and I'm happy to talk about it. It's complicated. I'll tell you that if I ever get a puppy, I would elect not to do any puppy or kitten vaccinations if I did get a puppy or kitten.
yeah,
Most of mine are all rescues, so they're over vaccinated by the time they get to me. And I do the best I can for their health and well care for the rest of their lives. They don't see another vaccination in my care anyway. Um,
yeah.
and
People
so
ask
that's a quick version.
Yeah, I would say it's a quick version because I know we've had this conversation before where it
We
really
have.
depends on so I'm going to say this before we go. It really depends on what you're feeding the dog, what other things you're doing. You can't just go, "Oh, Dr. Canizero said don't vaccinate my puppy." So I would say get with Dr. Canizero if you're interested and learn everything there is if you're going to not vaccinate your puppy because there's going to be a lot more than just not doing it.
And that's a
So
really good point because trying to go it on your own is not a good idea because we are here as homeopathic veterinarians to give you guidance toward well care for your pet, long term well care. And we're the ones that really can give you the best information about how to build your pet up to the best ability to hopefully keep them more protected if they are not going to be vaccinated, or even if you do decide to vaccinate, we're the ones that hopefully will guide you properly as to when and how much to give and which vaccines to give. So it's a hard question to answer because it depends, as what Carrie said, but it also depends upon what your needs are, what you're going to be doing. Are you going into puppy classes and what will they accept? What
yeah,
can we do to help in that vein? So it's more complicated than a quick, what do I recommend? Uh,
yeah,
Zero, but that depends. That completely depends. And I'm not a Nazi for no puppy or kittenhood vaccinations, but I am a Nazi about how little to give and how infrequently and when to give.
yeah,
Otherwise, we give too much. And
yeah,
yes, even parvo or distemper. That is part of the conversation I have with a new patient who has a puppy or a kitten.
yeah.
Because I think it's important to talk about the pros and cons and help you make a decision you feel more comfortable with. But you
Right.
need the information. Don't just make that decision on your own.
Yeah. So should I get the titer done? Lily, I think it's so much deeper than what we can offer you right here, right now. I hate to say it, but I really think that if you're deciding not to vaccinate, you need to really do a consultation with Dr. Canizero and spend more time because I know she's not going to just tell you don't or do. She needs to know a little bit more about where the puppy's going, what you're doing with the puppy,
What
what
your
he's
puppy's already had, what kind of diet your puppy is on, what you're
yeah,
willing to do for well care,
yeah.
and what risks you're willing to take, what risks you're not willing to take. It's not a yes no.
Not yeah, it's not a yes or no for sure.
Right.
And
It's
that's
just
where I
simple.
find myself too all the time when people are asking me, I'm like, well, I need to know a lot. Like it's crazy. So anyway, thank
Remember that the true holistic medicine, homeopathic medicine, is individualized treatment. There is no one size fits all. And
right,
whether we're talking about vaccines or medication, not medication, vaccines or heartworm prevention or diet, it's not a one size fits all. So please
right.
work with your homeopath. And if it's not me, then go to theavh.org and see if there is a homeopathic veterinarian, maybe speak to them, see if you feel comfortable with them, or work with someone like myself who's willing to do phone consultations.
Oh, Annie, thank you so much. That's just such a sweet thing.
Thank you, Randy. She's a
I
good thing.
wanted to give an example, and then I lost track. I was going to give you a quick example, but it's probably for the better because I'm always keeping you so much. I just want to let you guys know before I sign off and say thank you, everybody. Is I am going to be doing this little thing I went through about the tear staining. So stay tuned. It'll probably be in about 2 weeks. So we've got a lot of stuff coming up here in the near future. Next week, we have Ruby from Real Dog Box. She's actually going to be talking about the skin and the nutrients that feed the skin in the meats that our pets eat. And so we're going to be talking a lot about that. We've got a lot coming at you guys the next couple of weeks. Dr. Canizero, I'm sure will be back on. She is, like I told you, one of the most free with her time. And she's so busy. So it's like, gosh, you are so busy and yet you are so willing. It's just the passion just comes out of you.
It's
It's
my pleasure. And
and
to the person who
help.
asked, I do phone consultations to Canada. Yes. Sorry.
Oh, awesome.
That too.
No, I'm glad I didn't see that. So,
And
all
I know
right.
there's a lot of information, but work with a homeopathic veterinarian. That will help to distill the information so you don't get misinformation on the World Wide Web or Dr.
Yeah.
Google, as we
Yeah.
say.
Yeah.
So there's
Yeah.
good information, there's bad information, but get the guidance to partner up with a homeopathic vet that can help you make better decisions. And thank you
Yeah.
guys so much. I really appreciate you all. I do. And I
Yeah. You
appreciate you
guys,
sharing.
such
Come
amazing
visit.
questions tonight. Like,
We had really good questions tonight, and I hope that we
amazing.
satisfactorily answered those for people.
Yeah, yeah. You're always so thorough. So I think that it's a great thing. So behind the scenes is Lori, and she's always the one getting me going. I'd be remiss if I didn't say thank you to Lori because she always gets me signed up. So but thank you guys all. I will see you next week, Dr. Canizero. I'll talk to you soon. Can't wait to
You
see when
bet.
you're on next. And I'll see you guys soon, okay?
I think it's in a couple of weeks. So,
Couple weeks, yeah. Yeah.
Lori, thank you
Yeah.
so much for all that you do, and Lori for all you do. You guys are amazing. And
Oh,
be well. And what a cool chair you're in. Much cooler than
isn't it?
mine.
Yeah,
It
it's pretty
is. You are
comfy.
like the queen.
I pulled it out for something the other day and then I never put it back and it actually makes the lighting better. So I was like, cool, I'll just have this here. So
Yeah,
anyway,
I'm not sophisticated with the lighting. I know I have some probably
me either.
shading and whatever in here, but I don't have fancy lighting in my office. This is my office. It's my sunroom office. So
It's okay.
this is it. This is how I operate. So
It's
anyway,
awesome.
thank you
Yeah.
so much. You're so amazing. I feel so blessed to be with all of you. Thank you guys for the
Oh my
great
gosh.
questions as well.
Good night, everybody. I'll see you
Good
next
night.
week. Take
You
care.
betcha.